We'd like to thank you for joining our January 23rd Health Equity Meeting. We have a lot of great things to share with you today. Just quick housekeeping, please, we ask that you keep your speakers on silent or muted unless you have a question, and then you can raise your hand and then we will be able to call on to you. We're going to go next. We're going to show our agenda. Next slide. Show our agenda for the day, and I'll turn it over to our program director for Office of Health Equity and Racial Justice, Karina Leonard.
Thank you so much, Raymond. Good afternoon, everyone. My name is Karina Limerick, and like Raymond mentioned, I am the program manager for the Anne Arundel County Department of Health, Office of Health Equity and Racial Justice. And on behalf of senior leadership and the HERJ office staff, I would like to warmly welcome you to the first Health Equity Forum of 2023. So thank you all for being present in person and online. A week ago, on January 16th, Anne Arundel County and the nation at large observed Martin Luther King Jr.'s birthday. And this special observance is a national day of service to honor Reverend Dr. Martin Luther King Jr. for the principles of racial equality and nonviolent social change that he espoused during his lifetime. And so today we're going to anchor our County Health Equity Forum on the rich legacy of Dr. Martin Luther King Jr., who unfailingly called attention to poverty, lack of health care, poor quality education, racism, substandard housing, what we now often call the social determinants of health or the social drivers of health. Throughout our time together, we will reflect on his powerful words, which provide moral sustenance to those who work to advance health equity and racial justice, including me. And our featured speakers will discuss the public health approach to gun violence and heart health, two key issues of our time disproportionately impacting marginalized communities with limited resources. Our third featured speaker will guide us through a look back on MLK Day and a look forward to Black History Month in February. So before we get to that appointed time, let's start off by thinking about MLK's words. I read an interesting article on the 15-year battle for the Martin Luther King Jr. Day on the National Museum of African American History and Culture's website. It took 15 years of persistence by civil rights activists for the holiday to be approved by the federal government. And now we get to celebrate in all 50 states Martin Luther King Jr.'s birthday each year. So I invite you now to think about how you live, how you work, play, learn, worship here in Anne Arundel County, and the things that matter to you most. What do you work tirelessly to create or change? Dr. Martin Luther King once said that our lives begin to end the day we become silent about things that matter. Would anyone like to share what this quote means to them? Our lives begin to end the day we become silent about things that matter. The wheels turning.
For me, it's about just having a voice, and that sometimes we can allow the way that people think about us or think about what we do don't matter, but that's actually the time and opportunity for us to be the loudest and speak on the things that can impact our community and families and our culture.
Wonderful, thank you, Raymond. Would anyone else like to share?
Yeah, for me, we need to face the reality that we every day encounter in our lives. So do not be disappointed and be creative in every matter we face. I think, yeah, the sentence gave me that kind of thinking.
Thank you, appreciate your sharing. would like to share online?
Ms. Perry?
Yes, to me, it means that if you see something, say something. That if you see something or don't, react or try to do anything about it, you are part of the problem. So it's not just that we can't be silent, but we all should be working towards change and not just talking about it. I hear a lot of talk. I mean, we've had all kind of commissions and different things in the state. I want to see it's about result, action. What are you going to do? As far as myself, what I do, I volunteer with different organizations to give back. If I do constituent services work for the delegate, been doing it for 10 years, helping someone, find money to pay for a funeral when they don't have money. It's all those acts of kindness that we need to do to actually do something, because we can talk all day long. We can read quotes all day long, but what are you doing? What are you going to do? So that's where I think as a state, more or less, we're lacking, because we can talk about it. Oh, we've got enough documentation on everything, but we need more action. What are our results? What is the data? Check the data. What does the data say? We need to encourage everybody to speak with facts or don't talk. So that's what it means to me.
Thank you, Edith, for sharing so eloquently. I'd like to invite our health officer, Dr. Nilesh Kalyanaraman, to share a little bit about the Healthy Communities Program and why it matters and what we can do to support it.
Thanks, Karina. So I want to talk about the Healthy Communities Program. What we talk about here, we're talking about health equity, we're talking about what does it take, and you pointed out, what are we doing? A lot of what we did during COVID was really focused on making sure that we were reaching communities that were being hardest hit by COVID. And oftentimes those were either communities or people who we really hadn't interacted with them, and we should have been. And so what we really took from that was that we needed to not just do that for COVID, but we needed to continue those efforts for a wide range of services that we provide. Vaccinations into communities that we hadn't been in before, people's homes for those who are unable to get out of their houses, homeless shelters, to schools which had low vaccination rates, senior centers, making sure that we had easier access to walk-in services, expanding our HIV services, STI, sexually transmitted infection services, and making sure we're doing that in partnership with y'all and others in the community. That's our Healthy Communities Program. And we are investing in that, and we need to continue to invest in that. Our challenge is that a large part of that is funded through the expansion of the COVID funds. And we're going to need to get funding from the county to be able to continue these services. And so we wanted to have y'all join us at open houses there's 4 different times. One of them is already passed. That was on January 10th. But the next one coming up February 7th is with Kingdom Celebration, which is one of our community partners. On March 7th at the Parole Health Center, where we provide services in Annapolis, and then on March 21st in Lewis Scott, down in South County. And so we encourage you to join us at one of these locations. You can learn more. And we also need you to speak up and share the importance of these services to you, to the people that you serve, and let the county and the county executive know about the value of these programs. So with that, I'm going to turn it back over to you, Karina.
Wonderful, thank you. We do have some pictures of our January 10th open house, which was well attended. And we certainly want to see you at the forthcoming open houses. So at this time, I would like to invite our Deputy Health Officer of Public Health, Tony Geddes, to share about MPOX as well as the bivalent COVID-19 vaccine booster. She's going to provide overview and updates.
Yeah. So for those of you who may not have heard, we are no longer referring to monkeypox as monkeypox. So if you see MPOX written out, it is what was formerly called monkeypox. So this is the new term, language that we're using. And this will actually be the last time, we hope, that we'll be speaking to you about this. So ever since the initial cases showed up, we started bringing this information to this forum. One, because it did disproportionately impact our Black and Hispanic residents. Also because we want to make sure that you all have the right information to share with your community members and those that you serve. So we haven't seen a case of Mpox in a new case since October 19th, which is a great sign. We're really excited about that. And this is why we're going to discontinue the monthly updates during this forum. What we are not discontinuing is our efforts to vaccinate. So we are continuing to vaccinate at our Bay Meadow Clinic in Glen Burnie once a week. There is no information needed to provide to prove your eligibility for this. We do recommend that you schedule an appointment, but walk-ins are welcome. And so just wanted to make sure that you all knew where we were with Mpox and that we've seen great progress and hope to continue to vaccinate in cases. This is not just exclusive to Anne Arundel County. We've seen this at a state and national level. That cases have continued to trend down. So if you are interested in being vaccinated, we do still recommend it. The phone number is down at the bottom and places we can also test individuals at our health centers in Parole and Glen Burnie. So if you're interested, more information on our website, but really wanted to let this group know where we've been since October and that we're excited to see that positive trend continue. Okay, well, next slide, please. Oh,
Have they mentioned any side effects from the shot?
no, none that we're aware of outside of the normal, sore arm, blaze, headaches, the things that you typically see.
And we're out there, we can let people know. They'll ask that question.
Absolutely. And we can share that information with you to make sure you have all of the latest. Yeah.
Is the vaccine only for the Anne Arundel County residents?
So no, we'll vaccinate. If you are in another county, we don't try to make it difficult for folks. Maybe you work here, or maybe you weren't able to get an appointment somewhere else. So obviously residents are our primary focus, but if you come to us and there's a reason you need to be vaccinated here, we have enough vaccine that it's not an issue.
Okay, thank you.
Right, so then the second part for me is just making sure that everyone is aware of bivalent boosters for COVID-19 and trying to still encourage folks to come out and get those vaccinations. So at this point, every age group over 6 months old is eligible for a booster. So that's important, right? These groups have been approved at different timeframes. So at one point it was just adults, then younger children, and now we're down to the absolute youngest amongst us. If you have not received a bivalent booster, please do so. So if you got a booster last year, if you got a booster 8 months ago, if you got a booster and it wasn't the bivalent booster, please do schedule an appointment to get the bivalent booster. And why is this important? So this protects you against the most up-to-date variants. So Omicron is included in this. And we've also seen with the latest variant, XBB, that we're not seeing any particular reason to believe that it's not effective. It is effective, right? We haven't seen any uptick in hospitalizations that were kind of already on par. And so we're really encouraged that the vaccine is working the way that it's supposed to, but we do need people to be boosted. If you haven't had a booster at all, let's say you were vaccinated in 2021, I thought the other day, 2 years ago since we initially rolled these out. Vaccine that maybe you got in spring of 2021 is no longer protecting you the way that we need it to. And so we really encourage everyone to come out, get a booster. We are still vaccinating at several locations throughout the county. Please check our website. Again, appointments are encouraged, but walk-ins are absolutely welcome. If you can't schedule an appointment. And I think just one other note for the youngest children, so that's 6 months to 4 years old, because their initial series was a little different for them, it is recommended that they receive the same vaccine. So many of us may have mixed Pfizer and Moderna, and you got a Johnson & Johnson, and you got something else. For the little ones, if they got a Moderna, they need their booster to be a Moderna. So do please check with your healthcare provider. Some offices, because of storage and handling reasons, may only have one of the two. So just make sure, and they will absolutely check that before they administer a vaccine to you or your child. but just making sure we do have both at the health department. So if your child's provider doesn't have one, we have both, they're available. Please come out and get vaccinated.
So how far apart should you have this new vaccine versus the old one you had? Say you've taken one, a booster, hit you about 2 months ago. Can you the new one now, or you wait a certain period of time?
You are spot on. You're spot on with your 2 month. Yeah, so if you had, if you, for instance, and at this point, we shouldn't have anybody in that predicament anymore, because it was actually recommended that they stop with the monovalent boosters a couple months back. So we weren't supposed to give any more of those, even if you had them, because the bivalent was the most effective. But you can, if it's been 2 months, whatever reason you might have gotten a monovalent, you can get the bivalent vaccine. And the rates for our boosters, and we have excellent data on this. For our bivalent boosters is not as high as we would like it to be, right? So less than 30% of the time has been boosted. We know there's some fatigue around how many vaccines, there's flu shots, there's COVID vaccines, but we want to make sure that we don't take our guards completely down, just to make sure that we keep the positive trends that we've been seeing and the gains that we're making, being able to do things like this and sit in this room together. So thanks for me.
All right, so we will transition to an introduction of our first speaker, Siobhan Wilson Thomas, who will be talking about a public health approach to gun violence. And I'm just going to share a little bit about her in the interest of time. She earned her master's degree in social work from the University of South Carolina and her undergrad degree from Benedict College. She's experienced working with different populations, such as those who experience domestic violence, homelessness. She's also worked on public health issues such as Black maternal health, mental health, racial justice, and gun violence prevention. She now serves as the program manager for the gun violence interruption team here at Anne Arundel County Department of Health. And we are delighted to have her with us to talk about the public health approach to gun violence. As she prepares to share her screen, feel free to reflect on the words of Martin Luther King Jr., who once said, "True peace is not merely the absence of tension, it is the presence of justice."
Thank you, Karina, for the introduction. I am going to share my screen. Can everyone see it?
Yes.
Okay. So again, my name is Siobhan Wilson Thomas, and I am the GVIT program manager here for Anne Arundel County Department of Health. So today I'm just going to give you a brief background about GVIT. Then I'm just going to tap into the framework, the goals, a little bit of data, and then just some research, then some resources. And then I will have my contact information presented at the end of this presentation if you want to contact me to further get any more information or to see how you can become involved, and that will work. So just a little bit about GVIT, which is Gun Violence Intervention Team, is basically a task force that was launched under the Department of Health as a public health issue through collaborative meetings and work groups. We have a ton of partners who have come together to address this public health issue. It is really a data-driven approach to addressing gun violence and just really focusing on the data and the trends that are going on throughout the county and making sure that we are addressing it from an evidence-based standpoint. The GVI team was established in the mid-2020s, again, with different leaders from different organizations who have come together collectively to meet once a month to really address the issue throughout the county by way of education and policy and, again, data. Our mission is to prevent and reduce gun-related injuries and deaths in Anne Arundel County. And the vision is just to make a county community where all residents are safe from gun violence. That is our mission and our vision to address gun violence, to ensure that we are living in a more safe and gun violence free county. So our framework, as you can see, is really sticking to a public health approach, again, tapping into the environment, tapping into data, and tapping into the education and policies. We are really driven to community engagement, really focused, and we know that we can't do this work without the community. So really wanting community members to be involved in this work. And while we provide evidence to back up what we are doing, to really address what the evidence is showing, right? How can we address this? What is the numbers are showing? And really wanting to see the numbers go down versus go up. So we do that by way of different work groups, education. We have 3 work groups, which is education and policy, a data work group, and an environment work group. So we really try to tackle this from different points. And by doing that, we have work groups to where each work group is working on these areas so that we can make sure that we are tapping into the areas that we say we are. So in doing that, the task force have come together, and they had created a strategic plan that was launched last year, June, and it's on the website for view. And within this strategic plan, we are tapping into, again, coalition coordination, which was the development of the task force policy. This is for us to increase awareness throughout the public so that they can know what we're doing, the work that we're doing. And so we do this by way of, again, our thorough research and really trying to see what we need to push out there so that the public could be aware of the work that we're doing. And by this, we also monitor the evidence-based gun laws, right? What is new, what is to date, what laws do we need to focus on so that we can see how our work can align with the policies that are present or to come. We also do focusing on Goal 3, which is awareness and education. And again, that is pushing that out there. We have created toolkits that is on the website for people to be able to view, and I will share more of that as we go along. On the website, it has been several toolkits that has been created for public awareness so that they can see, again, what is out there, how they can get involved. Goal 4 is data. Again, we have also on the website, we have data. We update the data monthly, and then we update the data yearly so that you can see the trends and you can see the numbers to really identify what is going on. Is there, so you can really track to see if we're really making a difference within the county. We also focus again on community engagement. And our goal again is that so that we can have community organizations and community partners to really become involved and immersed in the works that we're doing, because we know that without community, we won't be able to push this work forward. So we want to hear from the community. We want the community to get involved and to really visit our website to get updates and really to attend our community meetings that is open to the public. Also, we want to focus on crisis response, and there is an Anne Arundel County response team, and we want to be able to identify how we can respond to incidents in a very effective way. So there's already a crisis response team out there. So our goal is to really see how we can enhance or how we can add to that response team. So we're going to tap into some data. So as you can see, this is just a graph of gun fatalities and injuries in Anne Arundel County from 2016 all the way up to 2021. If you notice, suicides are really the leading cause of gun violence in Anne Arundel County. If you look at the data and the map that is shown here, suicides is the highest that they have ever been was in 2021, based on the graph that is here. The lowest it's been was in 2016. So you can see that the trend kind of went up and then the trend went down, but now we're back at a we're increasing, but the numbers aren't increasing as much, but suicides are still a concern throughout the county, and they are the leading cause of gun violence. So there is still a trend in the direction that we don't necessarily want to see it trending in. We want to see these numbers going down. So we will continue to push out the work and information so that people could become more aware of what's out there to support individuals who maybe, having experience in some suicide ideation. So we want to continue to push out our toolkits because we want to see those numbers trend down. If you look at the map, also, when you look at gun injuries, right, we see that the numbers are actually trending down as of 2020, and the highest it has ever been was in 2017 at 167 gun injuries. As of 2020, we see that the number was 92, and again, we see that gun injuries are trending down, and we want them to trend down even further. When we look at this, we see gun homicides, and the number is not trending that much, but it has trended up just a slight bit. So again, we still want to see those numbers trend down. Oh God, sorry. This computer. Sorry about that. So if you look at this map right here, you'll see that again, like I said, if you look on the map, suicide is the leading cause based on the map. As you can see, everything that's in green is suicide when it comes to gun violence, and everything in yellow is majority of homicide. So if you look at the maps from a standpoint of the map, you will see that majority throughout the county, you see more suicides than you see homicides. So you see those little components within specific areas where there is homicides. And that's not to say that the number of homicides are not high. It's not to say that the numbers are not a concern, but we do see throughout the county that suicides are more of a concern when it comes to gun violence. But it doesn't take away from the fact that homicides are still a concern within our county in specific areas. Community resources. One of the things that we want to say is engagement opportunities. How can people get involved or immersed into our work? You can visit our website. You can participate in our community meetings. One of the things that we are in the process of doing is we are planning for our winter community meeting, and we will be sending out a newsletter. So we really recommend to go on our website, to fill out our email list so that you can start to get notifications about our meetings, so that you can really come and speak, and so we can hear your voices and we can really identify some of your concerns, and you can hear more about the work that we are doing. On this website, we do have our resource, our toolkits that has been created by our task force that with the help of other teams within our organization. Please, if you visit there, please also push it out, have other people go to visit our website so that they can also see what we have on the website. We have domestic violence toolkits, we have suicide toolkits, we have extreme risk protective orders toolkits, and these toolkits are really helpful. They have a lot of information that you can really immerse yourself in, and then push out to the communities that you service. Again, if you sign up for our email list, you would also be able to get notifications about the work that we're doing, and you can stay to update about the work that the task force is doing. Another thing, if you sign up, you will also be able to get notifications about gun lock distribution places. We are in a process of piloting a program to distribute gun locks, and we will be doing that at 3 specific libraries, 2 locations in Annapolis and one of the libraries in Glen Burnie. And that is something that, again, if you sign up, you can get that information so that you can see where we're going to launch that. And so that is something that you can also push out to your community. And again, you can contact me to find out more about that as well. But we really want you to be involved. We want you to attend our community meetings. We want you to come and to be able to identify what we're doing and to be able to share your concerns and your questions and how we can move this work along. We also want you to be able to push this information out and be able to really partner with us so that we can see what is a better way for us to get our toolkits out there, and so we can identify what's your capacity if you're open to displaying this information at your organization. So this is just some resources that if anyone is experiencing some suicide ideations, just some numbers that they can contact if they are experiencing suicide ideation, if they feel like they need someone to talk to, if they're in a crisis. These numbers are always important so that if you come across someone who is saying that I'm having a hard time, I need support, these are contact information that you can share, especially when you're in that community, you're going from door to door. I know that we have organizations here who are boots on the ground and really working with the community. So you want to be able to provide the community with resources so that they can know where they can go and get that support. And if you need more information or want to find out more about how you can get involved into the things that are to come up, please contact me, send me an email, and reach out to me, and we can further discuss that.
Thank you so much, Sharon, for giving us an overview. At this time, we're so delighted to have Dr. John Martin with us in person to share about his Dare to Care About Heart Healthy Maryland campaign. Just want to share a little bit about you before you get started. He's a board certified in vascular surgery and a fellow of the American College of Surgeons. He has held multiple positions throughout his career, including Chief of Vascular Surgery and Director of Heart and Vascular Services at Anne Arundel Medical Center. He's currently the founder and president of the Heart Health Foundation and the award-winning Dare to Care program. More importantly, he is passionate, a passionate leader who is relentless and committed to improving cardiovascular health for all. And so we're really excited to have you with us today.
Thank you. And when I get 2 hours to speak,
Like that.
I thank you very much. You can take it to the next slide. It's really a pleasure to be here. And what I'm going to discuss today briefly represents 2 decades of work here in Anne Arundel County. The Heart Health Foundation was actually founded in this county 20 years ago and then spread around the country, which we'll talk about, and around the globe. So this is a representative, our logo, if you see it around, that's the Dare to Care program, and that is a screening program that we've held here for the last 22 years. Next slide. I start with this one to get everybody's attention because over the last 3 years, everybody's been focused on COVID. It has been the principal thing in the news. It's what gets everybody's attention. But the leading cause of death all around the world and in our county is heart disease, and it's not even close. Yet we've not really paid that much attention to it. Whether it's heart attack, stroke, kidney failure, or amputations, all of these are manifestations of the buildup of cholesterol inside your arteries, causing vascular disease, and far and away the leading cause of death. If you think about 9/11 as an example, there were 3,000 people died that day. You can think about all the changes that were made. On that very same day, 3,000 people in the United States died from heart disease, and every single day since. And yet we've not had that same response. My goal today, this month, for the rest of my career, is to get people focusing on this because the vast majority of these events can be prevented. Next slide. These are the numbers. About 250,000 strokes occur every year from plaque building upside the arteries in your neck. AAA, which is a bulge of the aorta in your belly, gets about 15,000 deaths, and that is a gross underestimate because most people die at home and we don't know. Amputations, 160,000 every year, and that's not traumatic. These are from vascular disease, and it changes your lives. And heart disease, 1.5 million heart attacks per year and 325,000 sudden cardiac deaths. Those that you watch the football game and the player go down, that's sudden cardiac death. Now, he came back. And there's 6.5 million people today living with congestive heart failure, which dramatically diminishes your quality of life. So these numbers dwarf all other conditions. For people 65 and older, there are more people admitted to the hospital with heart failure than all cancers combined. It's not even close. Next slide. And the problem with vascular disease is it's that sneaky thing that you don't know it till it finds you. So this first picture on the left, that's a plaque inside the carotid artery that causes a stroke. It causes no pain, no symptoms until you have a stroke. The one in the middle, that bulge in the middle, that's an aneurysm. And the first time most people find out they have an aneurysm is when it ruptures and you die. And that picture at the end is arteries that go down a leg, and you don't have to be a vascular surgeon. No, one of these sides is not like the other one. And you can see that that's not enough blood supply to the leg. That's how you lose your leg. And nobody knows this stuff unless it's detected. You don't have a little warning label that pops up. And so it's really important that we find it before it finds us. Next slide. And these are what happened. These are all patients that I've taken care of in my career that have had problems that this is the first time they appear. On the left, obviously, that gentleman's going to end up with an amputation. On the right, that's obviously an autopsy picture, that a small aneurysm that ruptured and they died. And on the bottom, that's the last cheeseburger or piece of fried chicken you have, and that's what it looks like inside your arteries. And that's what I pull out when I operate on people. This is what's inside, candidly, all of us in this room to somewhat. Next slide. And the problem you say was, I go to my doctor, he does a physical examination. The problem is, physical examination is not sensitive enough. These things are not easy to detect even by a great physical examination, so it takes more. Next slide. And this is the one that I want you to remember this picture. And I tell people to remember this picture because I can give this lovely lady Colgate all day long, her teeth aren't coming back. So the key to this is prevention. You have to prevent the heart attack before it occurs, the aneurysm before it ruptures, prevent the legs from losing before it gets to be a problem. So this is all about stepping in early. And late, unfortunately, is often too late. Next slide. So that's why I started this program called the Dare to Care program. It's about carotid artery disease to prevent strokes, aortic aneurysms to prevent rupture, renal artery disease for high blood pressure, and extremity artery disease. I came into the emergency room one night, saw somebody with a ruptured aneurysm that died, someone that had a devastating stroke, and then ended up doing CPR to another patient. On the drive home, I said, that's it. I'm tired of being at the back end of the disease. I'm going to do something different. Within a week, I started this program. 22 years later, almost 70,000 people in this county have been through this program. Next. And what do? We do a simple ultrasound. You sign up for this program, you get your blood pressure taken, and a painless, free 15-minute exam. We can ultrasound your neck, your belly, and your legs, and we'll tell you whether or not you have plaque inside the arteries. Very simple, free, an easy program to participate in. Next slide. Do we screen? And this is really a function of money because we raise as a nonprofit foundation, we order for free. Our criteria now is anybody 60 and older, and I realize that's absolutely nobody in this room, but anybody 50 and older that may have a history of smoking, diabetes, high cholesterol, or family history. All you have to do is sign up and we will do this for free. Next slide. These are the results from just Anne Arundel County alone. We're actually just about knocking on the door of 70,000. And if you think about the number of people we've tested, it's a remarkable number of people. It's actually the largest and the longest running pre-vascular screening program in the world. And if you look at our results, 48% of the people we screen have something, almost half. And of that group, 2/3 are not on an aspirin and a statin, which are the recommended medications. So literally 1 out of every 3 people that walk through our door are eligible to have their medication changed. Now, there may be some contraindications and there are other things that your doctor will say, but at least looking at it, there's a whole world called secondary prevention. Put people on the right medicine, reduce their incidence of complications, and that's what we try to do. Interestingly enough, 4%, which may not sound like much, unless you've screened 70,000 people, have something bad enough that it needs to get fixed. So a critical carotid, a big aneurysm, bad disease in their leg, and these were people that didn't even know they had a problem. Next slide. And this is all about secondary prevention. Primary prevention is I want to start to prevent the problem from ever happening. I don't have vascular disease, I want to keep it from starting. Secondary prevention is about I've got plaque inside my arteries. Now I don't want it to get worse or have a heart attack and stroke. And the key things are very simple. Get your cholesterol under control. Control your diabetes. Don't smoke. Eat a good diet. Exercise regularly and take the right medications, which is aspirin and a statin. Very simple measures that we can do that can prevent a heart attack and stroke. Next slide. Here are some things that I would share with you that you can take home that really are telling. First of all, 80% of premature heart attacks and strokes are preventable. 8 out of 10. So this is not a problem that you can't prevent, you can. Simple drugs just like aspirin, a baby aspirin from the store that costs pennies can reduce your chances of heart attack and stroke by as much as 25%. Here's the thing that should scare you. Nowadays, it's moving to the left. 1 in 5 heart attacks occur in people under the age of 40. Under the age of 40. So it's really just, and 60 to 80% of heart attack and stroke victims had no idea of documented vascular disease at the time of their death. What you don't know can kill you. And so these statistics are sobering. They certainly are for me and have driven me from being a guy who likes to fix blood vessels, which I do. I'm a vascular surgeon and enjoy doing it, to spending most of my time trying to prevent people from ever needing it. I'm trying to put myself out of business. Next slide. This is the other thing that's important. With COVID, we all paid attention to COVID. And this is what's happened. There's been a dramatic spike. You can see that go straight up in mortality from cardiovascular disease. Why is that? It's not that COVID actually causes cardiovascular disease. Everybody stopped paying attention to it. They stopped going to their doctor for routine visits. They stopped going to the emergency room when they had chest pain because they thought, well, maybe it's COVID or I don't want to get COVID. And so as a result, literally a decade worth of progress we've made has been erased. So part of the reason you're going to see that we're on a big campaign here at Anne Arundel County and around the state through this foundation is to get people back on track. If you will, defibrillate the state to say, the leading cause of death in our state is cardiovascular disease. There are things that you can do. Let's refocus our attention on those big things. I don't want to ignore COVID or Mpox, but the leading cause of death is cardiovascular disease. And we need to pay attention to those things too. Next slide. This is the other thing. And part of the reason why I'm here and why I'm passionate about this is heart health is not affecting everybody either. In fact, there's a dramatic difference. Whether it's in the detection of vascular disease, whether it's the care of patients once they go into the hospital, when you look at the ultimate outcome, it's not the same. I live in that privileged class as a white person. Therefore, I get the best results. I have the highest detection rates. If you're communities of color, it's just the opposite. And it's getting worse. And I will tell you, and I say this, it's interesting as a white guy really being a diversity and equity guy. I thought myself as being colorblind. That's really the way I saw it myself and the way I practice medicine. But if you actually look at it, I started to learn, I'm not colorblind, I'm color naive. Because there are things that happen that I'm not aware of, or that are subtle, that are not there. And what I'm trying to do is be more outward and objective about this. Because I think if we're going to solve health equity issues, it has to be all of us at the table. Black, white, brown, green, yellow, doesn't matter. We all have to be here. And we all have to recognize there's a huge difference that has to be addressed. Next slide. If you look at the statistics, it's pretty striking. You can see the bars at the bottom versus the bars at the top. It's the difference between black and white. It's very obvious. Higher incidence of hypertension, diabetes, high cholesterol, heart attacks, strokes. There's a huge difference. Not all of which is just genetics. A lot of it is social determinants of health. And we talk a lot about that. We all have a role to play in this. Some of it's personal responsibility, but we have to address it and we have to make a difference because our state is becoming almost 50-50 between white people and people of color. And if that gap is growing, the people of color, we're never going to close the gap in mortality in the state. We have to lean in together. Next slide. I saved this slide and I use it in every presentation I do because it's a patient family I took care of where they lost a loved one. And I've always thought if you look into her eyes and you see how much loss is actually shown there, it's incredibly vivid. And if any of you have lost someone close in your lives, and I've lost my mother-in-law just recently from heart disease, it's devastating to families. And I, for one, don't want to see this happen one day before it should. So I keep looking at this picture and it motivates me to try to stop seeing these scenes play out in emergency rooms and homes across the country. Next slide. So this is what we're doing. I have a poster here. Anybody want to follow me out the car? I'll give you one to take to where you are and work. We're doing a campaign called Heart Healthy Maryland. It's all across the state. This is something that we want to encourage people to pay attention. You can sign up for screening. We're actually setting up events all across the state. We're going to do obviously a lot in February, but we'll keep going. There's also a whole host of other events. So if you just go to hearthealthymaryland.com, you'll see some stuff there. The website's a little bit slower than I am, but it'll catch up and we'll get information. Next slide. What you'll see here is I'm an overly ambitious individual and there are events throughout the whole month. On the 1st, we're actually screening at the State House so that the delegates and senators that represent us can know what we're doing and share it with their constituents. That night, if you're going over to the town center and you want to ice skate, we'll be there. On the 4th is a very important and ambitious day. We're screening in every single county in the state on that day. Literally 30 sites of care all across the state. Over 1,000 people will be screened that day. You can go online and see if there's a spot left. If it's filled, leave your name. We'll get you in afterwards. Don't worry. On the 11th is a benefit concert at Rams Head. On the 12th, a really important one I want you to take back to your churches. We're encouraging churches and synagogues all across the state to talk about heart health on that day, right before Valentine's Day, on Super Bowl Sunday. We can play the Super Bowl of life. It is certainly a day where actually heart health really matters. It's a really interesting day. You know what February 12th is as well? It's Abraham Lincoln's birthday. Another interesting man in our history that cared about this issue. So a really important one. February 19th, come to the mall, bring your pet. We're doing a heart walk with the SPCA at the mall. It's actually informative. The health department's going to be there. Care First is going to be there. The fire department's going to be there and a number of other companies. If you own a pet, it reduces your chances of having a heart attack. If you have a heart attack and you own a pet, your chances of survival are better. It lowers your blood pressure, improves your cholesterol. So if you don't have one today, go to the SPCA and get it done. And actually, the president of the SPCA happened to be my wife, so I'm pitching for her. We're quite an interesting family, as you might imagine. And then there's a critically important event on the 22nd that I'd love for you to put on your calendar. That's going to be at the Anne Arundel Community College at the Kaufman Theater. This is an event about heart disease in communities of color. How do we close the gap? And we're bringing in both national and state leaders to discuss this topic openly, candidly. These are diverse stakeholders that we hope will bring together to start to address this issue in our state. It'll be a fascinating conversation with the leaders that can actually address this issue. And my goal from that evening is to shine a bright light. So hopefully all the media will show up and all of you will bring them. And the second thing is to get these individual stakeholders to start working together so we can begin to close the gap. So with that, last slide. One more. I'll leave you with Proverbs because I think this is important. Above all else, guard your heart. Everything you do flows from it. So the Bible is behind us on this one. It thinks the heart's a big place to start. So help me, help you become part of this. Reach out to me, and I'll be happy to work with any of the people in your community, any of the associations that you have. Please engage us in the activities that we're doing in February. We'll make this a successful way to bend that curve and head things in the right direction.
Thank you so much, Dr.
We
Martin.
have one question in the chat. If someone is screened without insurance, where are they referred to?
So we'll find local resources to get them to. We have a lot of them, both at virtual ones on a national basis with different companies, but we'll find some place to get to them. They always have me to give them recommendations if there's something simple that they can be managed.
Thank you. Our next speaker is none other than Carl Snowden, who currently serves as the convener of the Caucus of African American Leaders. His career spans over 5 decades of work and advocacy to promote civil rights and ensure free speech, particularly for people of color. In 1988, Carl founded the Dr. Martin Luther King Jr. Committee, which hosts an annual awards dinner honoring people who, through their deeds, words, and actions, help to keep Dr. King's legacy alive. Carl has made Anne Arundel County a better place through all his efforts, and we are thrilled to have him with us today.
Thank you so very much. I'm fighting a little cold here, so excuse the raspy voice. Dr. Martin, thank you for your work and the work you're doing. It literally will save lives. And Ms. Wilson, you were talking with the Gun Intervention Task Force, and immediately came to my mind the young man that died, the first homicide that we had here in Anne Arundel County. It really does underscore the importance of us becoming involved as a community. And in the words of Dr. Martin, really recognizing that this is something that all of us must be engaged in. I was asked to speak briefly about the Martin Luther King Jr. event that we've had, and then talk about Black history in the future. Let me just share a quick story with people. If you've never heard this, you may have some appreciation why it is so important for people to tell their own stories in their own ways. I had the great fortune of meeting Rosa Parks in 1984. Mrs. Parks, as many of you know, were the reason for the civil rights movement that took place. And I'd always wanted to ask Mrs. Parks a question. It was a fundamental question. It's the question that Edith Perry in her own way asked. We see things going on in the world around us. Why do we not respond? And so I wanted to know, why was it a 42-year-old Black woman in a place called Montgomery, Alabama, who had been brought up in a society where segregation was the order of the day? Why was it on that day, December 1st, 1955, that she refused to give up her seat? I always wanted to know the answer to that question. I thought I knew it. So I had an opportunity to actually hear her answer the question. The reporter at First Baptist Church asked Mrs. Parks the following question. Mrs. Parks, why did you refuse to give up your seat on that day? And Mrs. Parks' answer I've never forgotten. I think it really summarizes what the movement for social justice is all about. What Mrs. Parks said is, because I refused to give up my dignity. She understood what was taking place was not about sitting on the back of a bus. Really was about dignity. When you hear Dr. Martin talk about in 2023, Imagine that it's still possible to go into a medical facility and then based on the color of your skin, implicit bias take place and people make automatic judgments about who you are. We will never know the number of people who have literally died because of racism. Oftentimes, person have died from some illness. My grandfather, which is my mother's father, my grandmother lived to be, my mother lived to be 104 years old. Her father only lived to be 60. And here's the reason why. He lived in a place called Davisonville, Maryland. And on a particular day, he had a stroke, Dr. Martin. He was driven from Davisonville to what was then called Annapolis General Hospital. Because of the color of his skin, he was not permitted to be waited on. They sent him to Freeman Hospital. And very few people will debate that by sending him to Freeman, it's one of the reasons he subsequently died. These decisions we make to be involved and not involved really makes a huge difference, huge difference. And so what we try to do on every Martin Luther King Jr. holiday is remind people that Dr. King gave his life literally to make America and the world a better place. And so whatever actions people tend to take, whether it's serving on that day, whether it's being a tutor, whatever people decide to do to make the world better, Dr. King literally gave his life for. We recently had the benefit of hearing Mississippi Congressman Benny Thompson, who was a delightful speaker. But of all the things I heard him say that day, the thing that struck with me most was when he asked the audience of almost 1,000 people, do any of you want your children to grow up to be like Trump? And you could hear the nervous laughter. It was a profound question. How many of us would prefer to have our children grow up with the values that Martin Luther King grew up with? It's not about being colorblind. It's about understanding our history, which now brings me to the point I want to share with you. In collaboration with the county executive, I'm going to have 2 programs. I invite you all to come to both of them. They're free. The county executive sponsors each year during Black History Month a program called Few of the Many. And this program, Few of the Many, is going to be held at Quad Waters Park. It's free. It's at 6 o'clock in the evening. And what we do is use that occasion to honor people locally here in Anne Arundel County who's made a difference. Some of the names of people I could mention to you, many of you will have never even heard of. If you go to a place called Anne Arundel Community College, where Dr. Martin's going to have his event, there's a building named after a woman named Katherine Johnson. If you ask the average person who Katherine Johnson was, they have no idea. But she was a magnificent African-American educator with incredible work. There's a woman named Sarah Carter, who happened to be the only African-American woman to ever get elected to the Anne Arundel County Council. We have, of course, the famous Wally H. Bates, who many of you are aware of. But there have been so many other people who've made huge contributions. So during Black History Month, we use this occasion to educate people about history locally and nationally. And I'll leave you with these 2 tidbits of information. Some of you may not even know this. Look it up. Don't take my word for it. That's why it's so important that we know the history. Most people think that the current Vice President of the United States, Vice President Harris, is the first to bring what's called a blended family to the vice presidency. A blended family is the fact that she's married to a white man and she has 2 white stepchildren. And they gave her credit for being the first to do that. It's just not true. It is not true. That credit should go to a man named Richard Mentor Johnson. Richard Mentor Johnson was the 9th Vice President of the United States. He served under a man named Martin Van Buren, who only served 1 term as President of the United States. And the reason why Martin Van Buren lost his election when he ran for re-election, because his vice president, Richard Mentor Johnson, was married to a Black woman named Jula Chin, You can imagine in that day, he came from Kentucky. It was illegal to be married to a Black woman. He not only married a Black woman, but he had 2 Black daughters. And the vast majority of people who have studied American history have never even heard of Julie Chen nor Richard Mentor Johnson. That's why this kind of history is important. Lastly, for women particularly, just last year, a statement was made that many, many people bought into. And that statement was, for the first time in American history, women, the Supreme Court had taken the right for women away for reproductive rights. And we heard that over and over and over again. The fact of the matter is that's not true. The first time women lost the right to reproductive rights was when the Supreme Court handed down a decision called the Dred Scott decision. That decision said that Black people had no rights that white people were bound to respect. And as a result of that, Black women lost the control of their bodies. All kinds of things happened to them, horrible things. They had no recourse from a legal standpoint. So it's important that we understand our history so that we don't repeat it. We be able to create a better environment and a better future for our children. And then lastly, in March of this year, again, in collaboration with the county executive, we're gonna have what's called the Michelle Obama Awards. Those awards will go to women, again, here in Anne Arundel County, who are doing incredible stuff, things that you don't often hear about, who are making a huge difference. That particular event will take place on March 14th. And again, it's open to the public and it will be at Quiet Waters Park. Raymond, thank you for the invitation. Thank you for the opportunity to share.
Thank you so much, Carl. In the interest of time, I do want to just bring your attention to our feedback survey. We certainly want to get your thoughts, your ideas on our forum. We do have an online survey where you can just share what you think about our forums, topics you'd like to have addressed during the forums. We'd like to hear from you. Again, I want to remind you to join our open houses. We do have 3 that are upcoming and we'd love to see you there. And lastly, Carl mentioned some events that you should stay tuned to for next month. But also the Office of Equity, Diversity, Inclusion has a webinar that's coming up you can join to kind of kickstart Black History Month. It's a webinar that's occurring on February 8th. You can check out their website. The link is included in the slides, so feel free to reference the link and sign up if you're interested. Keep in touch with us. Certainly we want to hear from you. You can reach out to us at helpequity@aacounty.org. We're also on Facebook, so feel free to like, share, and follow us. Because again, we want to just engage with you, not only during the forums, but during the days in between. So we'd love to hear from you. Feel free to complete the feedback survey. I'd like to thank all of our speakers for today's forum, as well as senior leadership who is represented today. We really appreciate your time joining us for an hour to talk about the various topics related to gun violence, Martin Luther King Jr., and as well as heart health. Thank you all so much. We'll see you next month.